Med history.
Human immunodeficiency virus, HIV, human immunodeficiency virus, causes HIV infection in humans, which ends with the development of acquired immunodeficiency syndrome, AIDS. Acquired immunodeficiency syndrome. HIV infection belongs to the group of anthraponotic viral diseases. In 1981, progressive damage to the immune system was first described against the background of Kaposi's sarcoma, or pneumocystis pneumonia, in homosexual men. Over time, the widespread spread of this disease has been noted. In 1982, it was named Acquired Immunodeficiency Syndrome. AIDS is an acquired immunodeficiency syndrome. In 1983, a previously unknown virus was isolated from the body of sick people. The pathogen was isolated simultaneously by the French virologist L. Montagnier from the Pasteur Institute in Paris and the American scientist R. Gallo from the National Cancer Institute in the USA. Initially, the isolated virus was called a lymphotropic virus, or a virus associated with lymphadenopathy. In 1986, by the decision of the International Committee of Experts on the Taxonomy of Viruses, this agent received the name human immunodeficiency virus, HIV, is a human immunodeficiency virus, HIV. The human immunodeficiency virus belongs to the order Viralis family. Retroviridae is a subfamily of the Orthoretrovirinae genus lentivirus. The name Retroviridae is associated with the presence in the virion structure of the reverse transcriptase enzyme, English retro, reverse, which provides the formation of double-stranded DNA based on information encoded in single-stranded RNA. The name of the genus lentivirus, Latin lenti slow, is due to the long incubation period and the slow development of the infectious process. It is assumed that HIV-1 arose as a result of transmission of the chimpanzee immunodeficiency virus to humans, and HIV-2, the red-headed mango bee virus. Acquired immunodeficiency syndrome, AIDS, is an indicator of the critical stage of suppression of human immunity, usually develops 5 or more years after infection. For the first time, this syndrome became known in the 80s of the 20th century, when deaths of young men from pneumocystis pneumonia, one of the markers of AIDS, began to be recorded in the United States. HIV infection is widespread everywhere, with the largest number of cases reported in African countries. According to UNAIDS, there are 35.1 million adults living with HIV worldwide, of whom about half are women. 940,000 people died from AIDS and associated diseases. HIV infection refers to anthraponotic infections, and this disease does not reproduce in animals. The source of the infection is a sick person. The transmission mechanism is parenteral. The main ways of transmission of the virus are sexual, homosexual and heterosexual contact, blood transfusion, injection, use of contaminated syringes, needles, instrumental, use of contaminated catheters. It is possible to transmit HIV by the transplacental route from mother to fetus, by transplantation during transplantation of infected organs, infection of a child with infected mother's milk. The sexual route of transmission is the main one. It is possible with anal, vaginal, and oral sex, regardless of sexual orientation. In the injection route, the virus is transmitted by using the same needles and syringes, especially by drug users. HIV can be found in almost all biological fluids of a sick person. However, a sufficient amount of the virus for infection is contained in blood, semen, vaginal secretions, pre-semen, lymph, and breast milk. Breast milk is dangerous especially for infants who have not yet developed gastric juice, which has a detrimental effect on HIV. Consequently, HIV-positive mothers are not recommended to breastfeed their children. The main risk groups are homosexuals, drug addicts, prostitutes, blood recipients, and medical workers. The high-risk group consists of people who practice unprotected anal sex, drug addicts who inject drugs, as well as their sexual partners. HIV is not transmitted through insect bites, through water and food, or through the air when coughing and sneezing with sweat and tear fluid, when shaking hands, when kissing, through dishes, clothes, when using the bathroom, toilet, swimming pool. The structure of HIV. The human immunodeficiency virus is an RNA-containing virus. A characteristic feature of HIV is the presence of the enzyme reverse transcriptase or revertase, RNA-dependent DNA polymerase, which provides synthesis of double-stranded DNA on a single-stranded RNA matrix with subsequent integration of DNA into the genome of the host cell. The viral particle has a spherical shape with a diameter of 100 to 120 nanometers. Virion has 72 spikes resembling a mushroom in shape. Each mushroom, like glycoprotein complex, consists of 3 molecules of glycoprotein Dr. 120, molecular weight 120 kDa, and 3 molecules of transmembrane glycoprotein Dr. 41, molecular weight 41 kDa. Glycoprotein Dr. 120, the cap protein, is located on the surface of the virion and is associated with glycoprotein Dr. 41, the legs protein, which permeates the lipid membrane. The glycoprotein Dr. 120 serves to attach the virion to the CD4 receptor and co-receptors or assistants on the surface of the infected cell, for example, CCR5 and CXCR4. Viruses with affinity for macrophage receptors are called M-tropic. Viruses that have affinity for T-cell receptors is called T-tropic. Glycoprotein Dr. 41 promotes the fusion of the supercapsid with the cell membrane. In the lipid membrane, HIV also contains membrane proteins of host cells, in particular ICAM1, H-later1, CD55, etc., captured during the formation of the supercapsid envelope of the virus when virions exit an infected cell. The life cycle of HIV. The life cycle of the human immunodeficiency virus consists of the following stages: adsorption and penetration of the virus into the cell by endocytosis, release of viral RNA, synthesis of DNA provirus and its integration into the genome of the host cell, synthesis of daughter virion RNA, synthesis of proteins of daughter virions, assembly and release of newly formed daughter virions from the cell by budding. The full life cycle of the virus takes place within 1-2 days. The virus that has entered the body is initially bound by the GP120 glycoprotein using a special pocket with the CD4 receptor of T lymphocytes and cells of macrophage origin, macrophages, dendritic, and microglial cells. Then there is an additional binding of the virus to another one, an auxiliary transmembrane protein co-receptor, which acts as the CCR5 receptor on macrophages, M-tropic viruses, or CXCR4 on T cells, T-tropic viruses. The core of the virion, which has penetrated into the cytoplasm of the cell, undergoes deproteinization on the way to the nucleus, as a result of which genomic RNA and related core components are released. After that, with the help of viral reverse transcriptase, complementary double-stranded DNA is synthesized on a single-stranded viral RNA matrix. This process takes place in the cytoplasm of the lymphocyte and requires the presence of the following components: viral RNA, transport RNA primer, reverse transcriptase, and nucleosides of the cytoplasm of the cell. Nucleosides are found in excess in lymphocytes. As a result of reverse transcription, a provirus, viral DNA, is formed, which is transported to the cell nucleus and embedded in nuclear DNA using the viral integrase enzyme. Subsequently, the provirus is a matrix for the synthesis of genomic RNA of daughter virions and mRNA, which ensures the synthesis of proteins of daughter virions. The mRNAs synthesized in the nucleus are transported to the cytoplasm of the cell, where viral structural and regulatory proteins are synthesized on ribosomes. After that, the genomic RNA molecules and viral proteins are transported to the assembly sites of the daughter virions. Initially, the core of virions is formed, which is transported to a pre-modified cellular plasma membrane, into which glycoprotein spikes are embedded. Virions leave the cell by budding, while the core of the virus dresses into the altered plasma membrane of the cell. The DNA provirus can remain inactive in the cell nucleus for a long time, persistent infection. During this period, the virus can only be detected by PCR. Activation of the provirus leads to the development of a productive phase in which HIV actively multiplies, HIV resistance. HIV is sensitive to physical and chemical factors, and dies within 30 minutes when heated to 56 degrees C for 10 minutes. When heated to 70 to 80 degrees C after 5–10 minutes, it dies under the action of disinfectants such as alcohol and ether. Within 1–10 minutes, HIV is inactivated by the action of 0.2% formaldehyde, 0.3% hydrogen peroxide, 0.5% Lysol. The virus is sensitive to solar radiation, UV radiation, ionizing radiation. However, the virus persists for a long time, up to 2 weeks, in a dried state, in dried blood, and in the blood of donors, it can persist for years. In biological materials at room temperature, the virus remains viable for several days. HIV dies quickly outside the body. Therefore, infection does not occur in a domestic way. HIV infection clinic. HIV infection is characterized by a specific clinical picture. This feature is due to the pathogen's tropicity to certain cells of the body and damage to various body systems. In 1990, WHO proposed a clinical classification of this disease, which was subsequently supplemented and updated. The following clinical stages of infection are distinguished. 1. Incubation stage. 2. The stage of primary manifestations. Flow options. Asymptomatic course. Acute infection without secondary diseases. Acute infection with secondary diseases. 3. The subclinical stage. 4. Stage of secondary diseases. 4A. Body weight loss of less than 10%. Fungal, viral, bacterial lesions of the skin and mucous membranes. Recurrent pharyngitis, sinusitis, shingles. 4B. Weight loss of more than 10%. Unexplained diarrhea or fever for more than a month. Repeated persistent viral, bacterial, fungal, protozoal lesions of internal organs, localized Kaposi's sarcoma, repeated or disseminated shingles. 4B. Cachexia, generalized viral, bacterial, mycobacterial, fungal, protozoal, parasitic diseases including candidiasis of the esophagus, bronchi, trachea, lungs, pneumocystis pneumonia, malignant tumors, lesions of the central nervous system. 5. The terminal stage. In practical work, the following periods of HIV infection are distinguished. The incubation period, the period of seroconversion, the period from infection to the appearance of detectable antibodies to HIV, lasts from 2–4 weeks to 3 months. The prodromal period, the stage of primary manifestations. This stage, it is characterized by subfebrile fever, urticaria, stomatitis, diarrhea, enlarged and painful lymph nodes. The stage of primary manifestations lasts for 1–2 months. By the end of the prodromal period, HIV antigens and antiviral antibodies appear in the blood serum of patients. The latent period, the stage of secondary manifestations, lasts from several months to 5–10 years. One of the symptoms of this period is generalized lymphadenopathy, enlarged, dense lymph nodes, painless. Possible lesions of the respiratory system, gastrointestinal tract, central nervous system. Antibodies to HIV are detected in the blood. The number of CD4 cells in the blood is reduced. Pre-AIDS stage, late HIV infection. This stage lasts 1–2 years and is characterized by inhibition of the cellular link of immunity. Infections that develop as a result of a progressive decrease in the number of CD4 cells. Pneumocystis pneumonia, toxoplasmosis, cryptococcosis, histoplasmosis, atypical mycobacteriosis, generalized herpes viral infections, candidiasis. The terminal stage is AIDS. The duration of this stage is 1–2 years old. During this period, the patient has neoplasia, in particular sarcoma Kaposi, lymphomas, mental disorders, progressive exhaustion. In the absence of antiviral therapy, the average life expectancy with HIV infection is 9–10 years, while the average life expectancy at the AIDS stage is about 9 months. As the disease progresses, the concentration of the virus increases and the number of CD4 cells decreases. AIDS is distinguished by vector, indicator accompanying associated opportunistic diseases. According to the etiological factor, they are divided into the following groups. 1. Bacterial infections, extrapulmonary tuberculosis, severe pneumonia, infections caused by atypical mycobacteria, etc. 2. Fungal infections, candidiasis, cryptococcosis, histoplasmosis, pneumocystis pneumonia, coccidioidomycosis. 3. Viral infections, herpes virus, cytomegalovirus, papillomavirus, etc. 4. Protozoal infections, toxoplasmosis, cryptosporidiosis, microsporidiosis, etc. 5. Other diseases, Kaposi's sarcoma, lymphomas, HIV encephalopathy, HIV debilitating syndrome, etc. Diagnostics. The basis of laboratory diagnosis of HIV infection is the identification of the pathogen, including RNA, its antigens, antibodies to HIV, and the establishment of changes in the immune status of the body in order to determine not only the fact of infection, but also the stage of the disease. Blood is mainly used as the test material, but it is possible to use seminal fluid, urine, and saliva. Diagnostic results can be positive, the presence of a virus, 18 negative, the absence of a virus, and questionable, the presence of only a part virus markers. Virological, serological, immunological, and clinical diagnostic methods are used to diagnose HIV infection. The virological method provides for the isolation of HIV in cell culture by co-culturing of the patient's lymphocytes with sensitive HH9 or CEM cells. However, the virological method is laborious and low sensitivity, so it is not widely used. The serological method is aimed at detecting HIV antigens in infected blood cells or antibodies in the blood serum. The standard method of laboratory diagnosis of HIV infection is the simultaneous determination of antibodies to HIV and the P24 antigen using enzyme immunoassay, ELISA, and immunochemoluminescence analysis, IHL. Antibodies to HIV structural proteins are determined using screening and confirmatory methods. Screening methods for detecting antibodies to HIV proteins are used to conduct mass studies. The most widely used ELISA, allowing to identify the total spectrum of antibodies against HIV antigens. The sensitivity of this method is 95%, and the specificity is also 95%. ELISA is performed using several test systems that differ in the composition of antigens, antibodies, and the format of the tests. Confirmatory methods are used in case of a positive ELISA reaction. In this case, the IB immunoblotting method is used, in which antibodies to individual HIV antigens are detected using special test systems. Prognosis and prevention. The prognosis for AIDS depends on the timely diagnosis of HIV infection and opportunistic diseases. It is believed that taking antiretroviral drugs prevents the development of systemic forms. Tuberculosis of various localization is the cause of death of HIV-positive patients in 50% of cases. Cerebral toxoplasmosis and pneumocystosis of the lungs in 17%, CMVI in 15%, visceral candidiasis in 13%. Other conditions account for fewer deaths. The appointment of antiretroviral therapy is indicated for patients within 2 weeks from the start of treatment of the identified opportunistic pathology, with the exception of tuberculosis. The development of preventive drugs to prevent HIV infection, vaccines, is actively underway. The main difficulty of their synthesis lies in the high rate of mutations of the virus. Non-specific prevention includes abstinence from unprotected sexual intercourse and drug use, a policy of monogamy, and the use of condoms. It is necessary to introduce educational programs dealing with HIV infection in educational institutions at all levels, conduct mass actions, distribute newsletters, leaflets, videos, and clips on television, radio, and other media.